All right. Well, good morning, good afternoon, good evening, everyone. It's a pleasure to be here. As mentioned, I am the Director of Patient Engagement for ICER, the Institute for Clinical and Economic Review. And today I'll start with a very brief introduction to some of the global trends that we're seeing in patient involvement for HTA. And then most of my time today I'll spend introducing ICER, our value assessment framework, our process for engaging patients, the impact of patient engagement in our reviews, and then talk a little bit about what I see as kind of the next phase of patient involvement. And one quick note here, I think the global term that we're using is patient involvement, but within ICER, we typically use patient engagement. And so I am using those phrases interchangeably. So starting with the global perspective, I think everyone here can appreciate that HTA bodies across the world represent a wide range of roles and structures within different country and health system contexts. There's different remits and processes, and given that, the way in which patients are involved in those processes can really vary. And I think one thing that is consistent, however, is just this growing recognition of the importance of involving patients in HTA. And that is definitely evidenced by just webinars like today, and just getting together and being able to discuss the progress made and the gaps that remain. It's evidenced by how many different HTA processes have really evolved over this last decade to be more inclusive of patients. I think ICER can be a really good example of that. And then evidenced by just the increase in the amount of publications on this topic. And so I think the recent publication of the second edition of Patient Involvement in HTA book that came out, it's always on my desk here, is a really great example of just the recognition and awareness and importance of patient involvement. With that, I think it's hard to talk about the global perspective without acknowledging the HTA regulation that's gone into effect in the EU as of 2025, and for the first time mandating patient involvement across Europe and their HTA work across their joint clinical assessments and scientific consultations. And I think that's just a good nod to this growing recognition. And I know that's still really early, and so we're all curious to see what the impact and the results will be on patient involvement for this regulation. Something else that we've noted is just that it's really the high income countries that have the resources to explore and implement practically patient involvement within different HTA processes. And the low and middle income countries continue to face challenges in being able to kind of explore this practically. And so just acknowledging that disparity, there are many challenges that may exist for other countries with less resources, just the lack of infrastructure in general for HTA, maybe infrastructure for patient advocacy, limited access to local data to support HTA, limited knowledge or expertise in the relevant research methods required to conduct HTA, low literacy rates, et cetera. And so there's a lot of ongoing challenges there. And I do think that there is a big push for international research collaborations as a really important way to kind of share guidance and practical ways that we can kind of bring some of these other countries along in terms of patient involvement. And then some of the recurring themes that we see for future priorities in patient involvement, capacity building is a big one that I think we're going to talk a lot about today in terms of just increasing the knowledge, the understanding, the resources needed to bring patients and patient groups to meaningfully participate in HTA, but in turn for HTA organizations to be effectively incorporating that patient input is also very important. And then finally, this look at the standardization of engagement methods. And so how do we kind of arrive at some sort of common methodology across agencies to be involving patients while also honoring kind of the unique needs and priorities and variations that we see across country and health system contexts. So with that, I want to transition into talking a little bit more about kind of ICER and what our focus is here. We are an independent 501c3 nonprofit organization conducting health technology assessment in the US. Here in the US, we don't have a formal government HTA agency. And so in the absence of that and the absence of formal or expansive drug price regulation, ICER really functions as an independent group that is putting out comparative clinical and cost effectiveness analyses for new treatments that are awaiting FDA approval. And our goal is to publish evidence-based recommendations for fair pricing and fair access within our evidence reports. And importantly, in the nature of us being an independent nonprofit, we cannot approve, price, or determine insurance coverage for drugs. And so we really are focused on these evidence-based recommendations. Now, in terms of, why do we invite patients into our process? So here in the United States, decisions around drug pricing and patient access are often made without patients. And we believe that patients as the end users of these new treatments need to be involved in decisions that directly impact their ability to afford and access treatment. And in future slides, we'll talk a little bit more about kind of the different dimensions of value, but patient input really can inform the many different dimensions of value that go into an HTA and lead to more meaningful HTA recommendations. And finally, we believe that patients can uniquely contribute their lived experience to the HTA process. And so in ICER's process, in addition to patient engagement, we engage clinicians and manufacturers and insurers, and all of those perspectives are really important, but they cannot replace what we learn about the direct lived experience that can only be understood by speaking directly to members of the patient community. So with that, I wanted to touch really quickly, I think before we can get into kind of the process for how ICER involves patients, it's really important to understand, what even are we measuring when we're talking about this comparative added value of new treatments. And our value assessment framework, which we also call the VAF, is really our guiding structure for developing our evidence reports. And it focuses on 4 key domains of value that I've listed here. So things that would be familiar in terms of the health benefits that a new treatment might offer in terms of improvement in quality of life or length of life or reduction of side effects, things like total costs in terms of healthcare system costs, societal costs, maybe in terms of lost productivity, cost to the caregiver, or even cost savings. And then importantly, I wanted to share with everyone today around ICER's domain that we call benefits beyond health. And these are intentionally the aspects of value that we have heard are important directly from the patient community, but that are either not measured within the clinical trial program or are really hard to measure. Things like how does a new treatment allow an individual to pursue an education or family life in a way that they couldn't before? What is the impact of this new treatment on caregiver quality of life? Are there important differences in maybe the methods of the treatment delivery or treatment setting that either reduces the complexity or increases the complexity of receiving this treatment? Are there opportunities to reduce health inequities across racial or ethnic groups because of access to this treatment? So all of these things are really hard to measure, but we know that are still really important for our understanding of value of a new treatment. And then finally, as part of the defining feature of HTA, we also really want to know about some of the social and ethical priorities in that dimension of value. And so I know that's a lot of text on one slide, but I'm hoping that we can kind of visualize all the different domains of value and all the different ways that patient input can directly inform these dimensions. And in terms of how this really kind of materializes within ICER's process and report, is our understanding of health benefits, usually informed by the clinical trial evidence that we have at that point, is conducted through our comparative clinical effectiveness analysis. Our understanding of total cost is understood through the comparative cost effectiveness analysis. But really importantly, this is just kind of half the picture here in that we still have these two additional domains. And that really comes to life during our public meeting deliberation. And so just wanted to emphasize that our, approach to the value assessment framework and every ICER review is both evidence-based and quantitative, but there are also these very important qualitative, deliberative aspects of conducting HTA. And I'm really excited to have Alan here to kind of speak about some of those aspects from his perspective. So moving into our patient engagement process here at ICER, I like to think about it in these four distinct phases. And so phase one of our process is an invitation for the patient community to share their lived experience with ICER. Phase two is an invitation to respond with feedback to draft iterations of our work. Phase three is an invitation to participate at our public meeting. And finally, we hope that in engaging in this process, that the very last phase really is we hope that the final ICER report can serve as a tool to further empower your patient community with evidence. And so for each of these phases, I wanted to just provide a little bit more context on how patients can engage with ICER. This is not an exhaustive list, but just to give everyone a sense of the different formats and avenues for input. So for sharing your lived experience, we offer virtual calls, we offer the Share Your Story form. It's an online form that lives on our website. And we also conduct interviews with patients and caregivers. In terms of responding with feedback, we accept many different forms of formal written feedback through our public comment periods. We have other feedback opportunities through calls and also early review of our deliverables prior to publication. At the public meeting, members of the patient community can attend the meeting. They can be invited to serve as one of two patient experts throughout the 6-hour meeting. They can deliver a 5-minute oral comment and participate on our policy roundtable. And finally, we hope that having an evidence-based report will allow these patient groups to continue advocating for fair pricing and fair access. So that's our process. And I also wanted to kind of walk through some of our patient-centered kind of engagement touch points that we have. And so at the beginning of every ICER review, I conduct a 1-hour onboarding call with every patient group that may be interested to better understand, what is HTA, what is ICER's goal, why are we inviting patients into our process, and how can you participate? And this has been just a huge way of kind of, I think, first pausing to kind of educate and, share our missions and our goals before kind of jumping into the involvement within the actual HTA review. And so that's been just an awesome experience to include within our process. We have several new patient-facing process and methods guides that I'll show here in a second, as well as a patient-facing summary of every ICER report that we call the ICER snapshot. This is a quick 5-page summary of what could be 100+ pages of a technical ICER report. And now every ICER process concludes with an end of review survey and debrief call that we offer to the key engaged patient advocacy organizations to share their experience in the process and any other concerns that may have come up so that we can kind of discuss and talk about how ICER can still continue improving in the ways that we involve patients. And then finally, a commitment to compensating patients for time-intensive activities during ICER's process. I know I'm running short on time here, and so just quickly going through some of these other slides in terms of the patient-facing process guides that we have to bring patients along and how they can share, respond, and participate. A quick guide on some of the cost-effectiveness tools that we use to kind of break some of these very complex terms into patient-friendly language. And then closing here with some case examples that I've pulled from some of our recent ICER snapshots from recently published reviews. And so just kind of zooming in on some of these case studies, we heard from the patient community for SMA that the clinical trial outcomes didn't quite meet all of the meaningful improvements that they would like to see in function. And so ICER was able to update our clinical section to reflect some of those additional clinical outcomes. for a review of a new gene therapy for retinitis pigmentosa. Patient input led us to add additional clinical outcomes to our economic model based on patients really emphasizing their desire to maintain stability for their levels of vision. For our review of multiple sclerosis, just ICER being able to better understand the patient experience and with navigating the healthcare system, frustrations with coordinating care and the lack of specialists in this field, and being able to elevate that within our report. And then finally, of understanding how the long diagnostic journey for patients with IgA nephropathy could help inform our key policy recommendation to help improve access to kidney specialists. And so just kind of showing the arc of different things, different ways in which patient input has impacted our clinical understanding, our approach to the economic model, our understanding of the patient experience, and also some of our final policy themes that come out of our meeting. And then to leave everyone here with just looking ahead at some of these upcoming patient-centered initiatives that I'm really excited about. Plugging the HTA, Patient and Citizen Involvement Interest Group, is now working on a new international collaboration to really define and evaluate the impact of patient involvement in HTA. So much more to come on that, but I think kind of from my earlier slide, just a great example of how we can bring different stakeholders together to be thinking about the practical implementation of some of these process adaptations across HTA systems and contexts. ICER's continued commitment to improving patient accessibility in general, but also their understanding and inclusion within ICER's approach to the cost effectiveness analysis part of our work. And so just a huge push for that this year. And then finally getting to share the exciting update that we're in the middle of changing terms for ICER's patient council. And we're going to be shifting our focus a little bit from kind of these broad levels of kind of effort put into creating patient engagement materials about HTA in general and the process in general, to kind of doing a deeper dive into specific drug review process adaptations that could lead to more meaningful patient involvement at ICER. So with that, I will close my presentation for today, and happy to answer any questions